Good afternoon, kids. Today we are going to talk about diabetes. We invited a professor of Harvard University, Douglas Melton, to tell you the main symptoms of diabetes type 1. It is increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tightening in the feet or hands, sores that do not heal, or unexplained weight loss.
There are several reasons of diabetes. The first one is a break of immune system. The main reason of appearing of diabetes of the first type is an individual failure in the work of immune system. That is why this type of diabetes is included into the list of autoimmune diseases. The second reason is genetics. Because of the genetic nature of the disease, it is considered that diabetes type 1 has a heritable character. The third reason is virus infections. The exact reason of emergence of any diabetes type are not studied completely, but they are the facts proved by the statistics. Specialists found the relation between affection by diabetes of the first type and the carried viral infections. The following diseases are considered as the dangerous ones: chickenpox, rubella, measles. The reason of that interrelation is that most of the virus infections have a feature to destroy or partly harm beta cells of pancreas. Organism is trying to compensate this damage, but in most of the cases it is impossible.
So what is happening during this process? During the day, pancreas is regulating the level of sugar in the blood, answering to the increase of glucose after eating. It produces insulin, which helps the cells to gain energy. Destruction is a base of this illness. This is functional and factual destroy of specialized cells of pancreas. During the diabetes type 1, immune system of an organism mistakenly kills beta cells. The body is left without insulin. These cells are located in islets of Langerhans. One of the possible solutions is the hormone insulin. People who study to control their condition on their own are forced to constantly inject carefully calibrated insulin doses. However, it is impossible to reach the amount of insulin which is close to the one produced by the healthy pancreas. In fact, it is very uncomfortable to inject the insulin every day on your own. That is why researchers are looking for the way to change the missing cells. Another cure for the diabetes was discovered not so long ago by the professor of Harvard University, Douglas Melton. He and his colleagues created a recipe which helps to turn stem cells of a human into functioning beta cells of pancreas. They can react on the glucose and produce enough amount of insulin for curing the disease. This research was conducted by Melton for 23 years from the time his son was diagnosed to have diabetes type 1. The innovative method of curing diabetes type 1 with the help of stem cells is excluding the abuse of traditional medicaments. This method fight with the main reason of diabetes by lowering hyperglycemia and related complications. In addition, the immune system is strengthened as well. New vessels are formed and the weak ones become strengthened. At the diabetes type 1, by the results of curing, the sugar in the blood is normalized.
So how does it work? The doctors make multiple copies and then inject them into the organism of a human. Stem cells are attached to the tissues of damaged pancreas and then are transformed into more active cells. Detailed steps. Usually the stem cells are injected into the pancreatic artery through catheter. The first, marrow bone harvesting. The first step is the process of taking the marrow from an iliac crest or haunch bone of the patient by a fine needle mini puncture under local anesthesia. Usually this procedure takes about 30 minutes. Processing the cells in a laboratory. In a laboratory, there is a test of quality of the produced cells and their count. The third step, implantation of stem cells. On the third step, the cells are implanted into the pancreatic artery with the help of catheter. Under the local anesthesia, catheter is inserted into the hip artery, and with the help of X-ray scanning, it is inserted forward until reaching the pancreatic artery, where the stem cells are implanted. The procedure is for about 90 minutes.
Unfortunately, there are several disadvantages of the use of stem cells by treating diabetes type 1. Firstly, some people can't handle the procedure of catheterization. Secondly, adult stem cells may not bring the expected effect because of the individual opportunities and features of each person. And third, this operation is pretty expensive. It may cost from $20,000 up to $100,000. But luckily, these disadvantages can be solved. If for any reasons patients cannot have a procedure of catheterization, they can choose intravenous injections of stem cells. Some patients with an illness of kidneys may choose an alternative replantation of stem cells by method of intravenous injection. To the patients suffering from a diabetic peripheral neuropathy, the portion of stem cells is injected into foot muscles by an intramuscular injection. Actually, an adult person can find a donor who can give him stem cells. A potential donor undergoes special tests to study the compatibility with the patient in more detailed way. Then he undergoes medical examination and he is explained in detail what the procedure of donorship is. After that, a potential donor signs a donor agreement. Curing the diabetes type 1 in Germany is less expensive. So in Frankfurt it costs $1,950 per session, and in Bern it costs $9,542 for package. So kids, this is the end of our lesson, and as a home task you need to read about the diabetes type 2 and how to treat it.